Our case study is all about gonorrhea. Objectives. The general objectives of our study is that at the end of the study, the learner shall improve their understanding and knowledge regarding the disease process, provide interventions that promotes safe patient-centered care, and possess a positive manner in giving holistic care to the patient. Our specific our specific objectives are at the end of the study, the learners will identify what is gonorrhea, identify signs and symptoms that may or cause gonorrhea, formulate and provide an individualized nursing care plan, and lastly, identify and discuss its appropriate management effectively to attain optimal health of the patient.
Introductions of conditions or disease. Gonorrhea is a sexually transmitted disease or STD caused by infection with the Neisseria gonorrhoeae bacterium. Neisseria gonorrhoeae is also known as gonococcus for singular or gonococci for plural. It is a species of gram-negative gonococci bacteria-like after an episode of gonococcal infection. Gonorrhea infects the mucous membrane of the reproductive tract, including the cervix, uterus, and fallopian tubes in the woman, and also for the urethra in women and men. We can get this disease by having sex with someone infected with the bacteria causing it. Symptoms include the feeling between burning sensations when peeing, swollen testicles for men, white, yellow, or green discharge from the penis or more vaginal discharge than usual, and pain when having sex. Gonorrhea can lead to serious complications when left untreated, so it is important to receive treatment as soon as possible.
The subject for our case study is a 17-year-old junior high student named Tracy.
She is very popular at school and is well liked by her teachers and classmates. She has dated a few boys from school but claims not to have been sexually active before prom night. She has been in reasonably good health for the past 17 years but has recently developed a urinary tract manifestation, more frequent urination, and increasingly severe urethral burning during urination that has persisted for 3 days. She reports mild anal itching but denies chills, fever, nausea, vomiting, and abdominal pain. She also noticed an abdominal discharge from her vagina and described it as a yellow and kind of thick. When questioned further, she reported that she had sex for the very first time with my prom date 2 weeks ago. They did not use a condom, but she has been taking the pill for 6 months. She reported to her mother, who kept her out of school today and immediately made a doctor's appointment.
Patient's profile and history. The patient's name is Tracy, gender female, age 17 years old, civil status single, occupation student. The reason for seeking care. The reasons for the seeking care of the patient is the patient experienced pain when going to the bathroom, and he verbalized that I probably have done something that I shouldn't have on prom night, and now it hurts when I go to the bathroom.
History of the present illness of our patient. The patient is complaining of frequent urination, increasingly severe urethral burning during urination that has persisted for 3 days, and she noticed an abnormal discharge from her vagina. She describes the discharge as yellow and kind of thick. She reports also a mild anal itching. She stated that she had sex for the very first time with my prom date 2 weeks ago, and they did not use condom, but she has been taking pills for 6 months. Her past medical history: asthma 11 years, immunization are up to date, and patient receives annual physical examination and routine follow-up care for asthma. Family history genogram. The red circle represents the male with heart disease. The square with the red color, female with heart disease, and the yellow color square, female with high blood pressure. The circle with the green color is a healthy male. The square that a blue color represents the female with gonorrhea, and the black gray black circle represents the male with muscle problems.
Diagnostic results tests particularly useful in identifying conditions of the patient. First is review of systems. Urine secretions result increased frequency and urination and urgent urination with mouth incontinence or loss of bladder control. It indicates that the patient has polyuria. The opposite of polyuria is oliguria. Next is rectal result. No rectal discharge and bleeding, no rectal pain, tenesmus or cramming, and constipation. It indicates normal. Skin, no rash and other skin manifestation indicates normal. Tendon result, no joint or tendon pain and swelling indicates normal. Head and neck, no recent onset headache, neck pain and stiffness indicates normal. Chest, no chest pain, cough, shortness of breath and palpitations indicate normal. Throat, no sore throat and dysphagia or difficulty of swallowing indicate normal. Next is physical examination. General appearance results well developed, well nourished young white female in no acute distress indicates normal. Pleasant and trim back uppers mildly fatigued. Mildly fatigued indicates overwork, poor sleep, worry, boredom, or lack of exercise. Vital signs. Blood pressure results 114/64 mm of mercury while sitting indicate normal blood pressure and without abnormal findings such as hypertension, potentially hypertensive, Stage 1 and Stage 2 hypertension. Next is pulse 120 beats per minute regular indicates tachycardia, in which the normal range is 60 to 90 beats per minute. Tachycardia opposite is bradycardia. Next is respiratory rate. Results 16 not labored. It indicates no abnormal beats per minute such as bradypnea and tachypnea. Next is temperature. Result is 98.7 degree Fahrenheit or 37 degrees Celsius. Indicate no abnormal temperature such as hypothermia, elevated pyrexia, and hyperpyrexia. Weight 114 pounds, height 65 inches, calculated BMI is 31.39. It indicates no abnormal BMI such as underweight, overweight, obesity, class 1 to obesity class 3. Next is abdomen. Results negative rebound, tenderness, and guarding in all four quadrants with palpation. It indicates patient muscle relaxation and no sign of elicitation of tenderness by rapidly removing the examining hand. Next is soft and non-distended. It indicates normal, in which it indicates without any discernible palpable masses or hepatosplenomegaly. Results positive bowel sound. It might indicate abnormal findings such as hypoactive and hyperactive. Negative hepatosplenomegaly indicates no condition that causes swelling and enlargement of the liver and spleen. Negative masses and broods indicates no vascular sounds resembling heart murmurs and no growth or swelling in a part of her abdomen. Next is genital or rectum. First is genital. Vulval results no sign or symptoms of erythema and edema. It indicates normal. Vagina urine color, thick yellow-white discharge and mild erythema. Agents that affect color, excessive fluid intake, and some fads, medications, stress, exercise, blood. Genital cervix results friable and shows yellow-white discharge from OS. Appearance Cloudy urine, white or yellow, may be evidence of infection with pus or microscopic blood present, but it can also be caused by kidney stones, food, vaginal discharge, and dehydration. Next, by manual exam, no sign or symptoms of masses, positive sign or symptoms of motion tenderness. No sign or symptoms of masses indicates no bulging when touching. Positive sign or symptoms of motion tenderness indicates pain when touching or moved. Next is genital uterus. No sign or symptoms of initial tenderness indicates that fallopian tubes and uterus are not painful when touching. Next is rectum. Stool results no sign or symptoms of clean stool or hemoglobin stool. It indicates no presence of mucus, blood, or blockary stool. Rectum anal positive sign or symptoms of mild anal erythema and edema indicates erythema and swelling may indicate bacteria or parasite. After lab results is laboratory test. First is sodium result 134 milliequivalent over liter. Normal values is 135 to 145 milliequivalent over liter. It indicates that the patient has hyponatremia. Hyponatremia opposite is hypernatremia. Next is potassium. Results 4.4 milliequivalent over liter. Normal values is 3.5 to 5.0 milliequivalent over liter. It indicates normal, having no hypokalemia and hyperkalemia. Next is chloride 101 milliequivalent over liter. Normal values is 101 to 112 milliequivalent over liter. It indicates normal, having no hypochloremia and hyperchloremia. Next is bicarbonate. Results 27 milliequivalent over liter. Normal values is 22 to 32 milliequivalent over liter. Indicates normal, no metabolic acidosis and no metabolic alkalosis. Next is blood urea nitrogen. Results 12 milligrams over deciliter. Normal values is 8 to 20 milligrams over deciliter. Low and indicates normal, having no low and elevated kidneys that are not working as they should. Next is creatinine. Results 1.1 milligrams over deciliter. Normal values is 0.6 to 1.2 milligrams over deciliter, having no abnormal findings such as low and elevated that can cause kidneys that are not working as they should. Next is glucose fasting or glucose test. Results 98 milligrams over deciliter, in which the normal values is 60 to 110 milligrams over deciliter, and indicates not eating but doesn't show abnormal findings such as low prediabetes and elevated diabetes. Next is magnesium. Results 1.9 milligrams over deciliter. Normal values is 1.8 to 3.0 milligrams over deciliter, having no abnormal findings like hypomagnesemia and hypermagnesemia. Next is phosphate. Results 4.2 milligrams over deciliter. Normal range is 2.5 to 4.5 milligrams over deciliter, having no abnormal findings such as hypophosphatemia and hyperphosphatemia. Next is hemoglobin, having results of 13.4 grams over deciliter, 12.0 to 15.5 grams over deciliter is the normal range. It indicates that the patient results is having no abnormal findings such as anemia and primary erythrocytosis, polycythemia vera, secondary erythrocytosis, chronic hypoxia, and next is hematocrit. Results is 43.1%. Normal range is 35 to 45%, having no anemia, blood loss, and heart disease, dehydration, and smoking. Next is platelet count test. Results is 225 times 10 raised to the power of 3 over millimeter raised to the power of 3. Normal values is 150,000 to 450,000, having no abnormal findings such as thrombocytosis and thrombocytopenia. Next is white blood cell. Results is 13.5 times 10 raised to the power of 3 over millimeter raised to the power of 3. Normal values is 4,800 to 10,800 over cm. It indicates that the patient has abnormal findings such as immune system is working to destroy an infection. And the opposite of it is injury or condition is destroying cells faster than they are being made or that the body is producing too few of them. White blood cells indicate nucleus, bands, blends, monos, is. Nucleus or neutrophils results is 70%, normal range is 57 to 67%, having abnormal findings such as neutrophilia. Neutrophilia opposite is neutropenia. Bands or basophils results is 8%, normal values is 0 to 1%, having abnormal findings such as basophilia. Basophilia opposite is basophenia. Next is lymphocytes. 17%, normal range is 25 to 33%, having no abnormal findings such as lymphocytosis and lymphopenia. Next is monocytes. Results is 4%, normal range is 3 to 7%, having no abnormal findings such as monocytosis and monocytopenia. Next is eosinophils. Results is 1%, the normal range is 1 to 4%, having no abnormal findings such as eosinophilia and eosinopenia. Next is urinalysis. Urine color results is dark yellow. Normal values is pale yellow or amber or darkens. It indicates normal. Urine appearance results is slightly cloudy. Normal values should be clear but may be slightly cloudy. It indicates that the urine appearance is normal. Specific gravity is the result is 1.022. Normal range is 1.016 to 1.022. It indicates normal. pH result is 5.0, normal values is 5.0 to 6.5. It indicates normal. White blood cell or high-powered field result is 10, while the normal values is 0 to 5. So it indicates that the white blood cells in the urine are indicative of infection. If it increases, usually indicates an inflammatory process. Red blood cell over high-powered field result is 10. Normal values is 0 to 5. It indicates that the red blood cells are not a normal finding in urine and should appear rarely. Next is bacteria. It is positive of gram-negative diplococci, and the normal values of it is having no gram-negative diplococci. So it indicates that the urine stored in the bladder is normally free of microorganisms supposed to be. If an infection is present, then there is usually an increase of white blood cell count along with increased bacterial count, but if urine is contaminated, the white blood cell is often low. Next is nucleic acid amplification test or NAAT. First is PCR of polymerase chain reaction on cervical swab specimen. Result is positive of Neisseria gonorrhea and Chlamydia trachomatis. It indicates collective for bacterial culture and sensitivity testing. If bacteria was present, then it needs monitoring responses to antibiotic therapy. Polymerase chain reaction of urine specimen is also positive of Neisseria gonorrhea, and Chlamydia trachomatis. It indicates also collective for bacterial culture and sensitivity testing. Bacteria was present, then it needs monitoring responses to antibiotic therapy. All in all, if there was a positive result, it indicates that the presence of an active bacterial infection.
Next is drug study. There are 5 medications given to the patient, which are ethinyl estradiol, norethindrone, albuterol, beclomethasone, and salmeterol. First is ethinyl estradiol. Classification: hormones and synthetic substitutes estrogen. And its indication: ethinyl estradiol is commonly used as one of the most effective birth control pills. And its mechanism of action: ethinyl estradiol is a form of birth control used as a contraception to prevent pregnancy. And it is also used to treat ovarian cysts, abnormal uterine bleeding, and polycystic ovary syndrome. Some of its side effects and adverse reactions are headache, dizziness, hypertension, nausea, vomiting, diarrhea, and more. And its drug interaction: aromatase inhibitors, ospemifene, tamoxifen, tizanidine, tranexamic acid. And its nursing consideration: tyrosine allergy, breast cancer, undiscovered abnormal vaginal bleeding, active or past thromboembolic disorder, thromboembolic disease, pregnancy, breastfeeding, metabolic bone disease, renal insufficiency, and more. Patient teaching: consult the doctor first before taking this medicine. Next is norethindrone. Classification: contraceptives, progestin. And its indication: norethindrone is used for contraception or to treat conditions such as amenorrhea, abnormal uterine bleeding, and endometriosis. And its mechanism of action: norethindrone prevents ovulation. This medication also causes changes in your cervical mucus and uterine lining, making it harder for sperm to reach the uterus and harder for a fertilized egg to attach to the uterus. Some of its side effects and adverse reactions are nausea, vomiting, headache, dizziness, mood swing, trouble sleeping, weight gain or loss, acne, breast swelling or tenderness, change in sexual interest, unwanted hair growth or hair loss may occur. And its drug interactions: rifampin, St. John's wort, azole, antifungal, so on and so forth. And its nursing consideration: norethindrone may cause some degree of fluid retention such as epilepsy, migraine, asthma, or a heart or kidney problem. And its patient teaching: take this medication as exactly as it was prescribed. Do not let the patient take this medication in larger amount or small amounts. Take it for longer than the recommended by the doctor. Next is albuterol. Classification: beta-adrenergic agonist. And its indication: albuterol is used to prevent and treat lung illness such asthma and chronic obstructive pulmonary disease, which include trouble breathing, wheezing, shortness of breath, coughing, and chest tightness. And its mechanism of action: albuterol is a bronchodilator that relaxes muscles in the airways and increases airflows to the lungs. It is used to prevent bronchospasm in people with reversible obstructive airway disease and exercise-induced bronchospasm. Some of its Side effects and adverse reactions are fine tremor, anxiety, headache, muscle cramps, dry mouth, and palpitation are the most commonly reported adverse effects. Tachycardia, arrhythmia, flushing of the skin, myoclonics are fine tremor, anxiety, headache, muscle cramps, dry mouth, and palpitation are the most commonly reported adverse effects. Tachycardia, arrhythmia, flushing of the skin, myocardial ischemia, and sleep and behavior abnormalities are some of the other symptoms. And its drug interaction, mild interaction with albuterol include bendroflumethiazide, bumetanide, chlorothiazide, and so on and so forth. And its nursing consideration, patient with heart disease, asthma, glaucoma, diabetes, hypoclemia, hyperthyroidism, or seizures should exercise caution when taking this medication. And its patient teaching, use albuterol inhalation exactly as prescribed by the doctor. Do not use in larger or small amount or for longer than recommended. And avoid getting this in your eyes. If this does happen, rinse it with water and seek for medical attention. Next is beclomethasone. Classification: corticosteroid glucocorticoid hormone. And its indications: beclomethasone is used for treating mild, moderate, or severe asthma in adults or children. And its mechanism of action: beclomethasone prevents the release of substance in the body that cause inflammation. It is used to prevent asthma attack. And its side effects and adverse reaction: beclomethasone inhalation may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Headache, sore throat, runny or stuffy nose, back pain, nausea, cough, and painful speech. And its drug interaction, bronchodilators include albuterol, Ventolin, Perbuterol, and Bitoterol. And its nursing consideration: acute asthmatic attacks, status asthmaticus, systematic fungal infections, allergy to any ingredient, lactation, untreated local infections, nasal septal ulcer, recurring epistaxis, and nasal surgery trauma. And its patient teaching: do not use Beclate inhaler to treat asthma attack that has already begun. To best treat the conditions, use all the medication as directed by the doctor. And last, salmeterol. Classification: long-acting beta agonist or LABA. And its indication: salmeterol is used to prevent asthma attack and treat chronic obstructive pulmonary disease. And its mechanism of action: the stimulation of beta-2 adrenoceptors results in bronchial smooth muscle relaxation, bronchodilation, and enhanced airflow. Side effects and adverse reaction: palpitation, fast heart rate, elevated blood pressure, tremor, nervousness, and headache. Throat and upper airway irritation can occur. And its drug interaction: diuretic, antibiotics such as clarithromycin or telithromycin, and so on and so forth. And its patient teaching: salmeterol inhalation may increase the risk of asthma Use only of the prescribed of this medication and do not use it for longer than recommended by the doctor. Tell the doctor if the symptoms do not improve after 1 week.
So this is our concept map.
Predisposing factors: sexual exposure to an infected partner without barrier protection, for example, failure to use a condom, early age of onset of sexual activity. And for the precipitating factors, failure to use condom during sexual activity, engage with sexual activity at the age of 17.
So this is the pathophysiology of a gonorrhea infection. It is caused by a bug referred to as Neisseria gonorrhoeae. The reason why we called gonorrhea as a sexually transmitted infection is because it undergoes a process referred to as a transmission, where it moves one person to another by several mechanisms, most commonly through sex, which include an oral sex, vaginal sex, or even anal sex. So the pathophysiology of gonorrhea infection has four main stages. The first step is the attachment to mucosal surface. So this mediated by the villi. The villi attach directly to the columnar epithelium of the host mucosal surface. And the next is the invasion. The bacteria itself initiate process called parasite-directed endocytosis. This allow the gonorrhea access to the interior of mucosal cells. Once it is inside the cell, it triggers immune response where the white blood cells will detect that something is wrong, and they'll come up to the bloodstream and attack where the gonorrhea has spread. So if a single gonorrhea enters to the epithelial cell in your urethra, it will cause the cell to die, in process that referred to as apoptosis. So apoptosis is where the body will specifically decide to kill a cell that is doing something wrong, or a cell that has been infected, and as a result of immune response, the tissue damage happen. But oftentimes there are multiple organisms kind of spread along the urethral tract, which can cause more white blood cells come to the bloodstream to attack the bacteria or cell that are infected. And this is where we get the inflammation of the urethra, causing things like pain when you urinate, maybe some burning as well, and general discomfort. So if the gonorrhea spread even further up from the cervix through the uterus and actually came out to the fallopian tube to cause an infection within the pelvic cavity, which is why it's called the pelvic inflammatory disease. And this is the clinical manifestation of our patient. Discharge from the vagina, watery, creamy, or slightly green. Pain or burning sensation while urinating. Urge to urinate more frequently. Anal itching positive for bowel sound. Cervical motion. Mild anal, arithmetic, and edema.
So these are the nursing diagnosis of this clinical manifestation. Impaired urinary elimination related to the inflammatory process as evidenced by mild incontinence. Intervention in independent, determine client's pattern of elimination. Encourage adequate fluid intake. Provide patient and family with information regarding the treatment plan options. Dependent, administer fluids as indicated. Refer to urinary specialist as necessary. Acute pain related to the biological injury agent as evidenced by self-reports of pain. Interventions. Discuss mode of transmission of specific infections as appropriate. Discuss management strategies for persistent signs and symptoms. Demonstrate and encourage use of relaxation skills such as deep breathing, visualization. Encourage client to verbalize concern, active listen to these concerns and provide support. Dependent administer fluids as indicated. Refer to urinary specialist as necessary. These are the nursing diagnosis of the right side of our concept map. Connected to this anal itching, positive for bowel sound, and etc. Nursing diagnosis: impaired comfort related to illness related symptoms like itching as evidenced by alteration in sleep pattern. Independent: assist with encourage of use of relaxation techniques like focused breathing, guided imagery when client is able. Encourage verbalization of feelings where possible about discomforts including pain, itching, and etc. Obtain clients' assessments of pain to include location, characteristics, onset, durations where possible. Encourage client to report changes in pain. Use communication techniques such as listening and empathy. So for the dependent, administers medication as prescribed by the physician, refers to primary care provider, and assists with treatment for underlying cause. So that's it.
For lab diagnostic results, at the other side, the blue one, the hexagonal shape. Urinary cyst color dark yellow, appearance slightly cloudy, SG or specific gravity 1.022, 10 white blood cells per high power field and 10 red blood cells per high power field. Positive for gram-negative diplococci. For the nucleic acid amplifications, PCR of cervical swab specimen for positive Neisseria, gonorrhea, and chlamydia. PCR for urine specimen positive for Neisseria, gonorrhea, and chlamydia.
So the nursing care plan consists of assessment, diagnosis, planning, interventions, rationale, and last is the evaluation. So first is subject assessment. So the subjective data we gathered from the patient is her first chief complaint. I probably have done something that I shouldn't have on prom night and now it hurts when I go to the bathroom. So the problem identified is pain when going to the bathroom. The diagnosis is acute pain related to the biological injury agent as evidenced by self-reports of pain. Biological injury agents are microorganisms like infections, bacteria, and parasites. So next is the planning. In terms of planning, we follow the SMART goals. Specific, measurable, attainable, realistic, and time-bound. So after 8 hours of intervention, the patient will verbalize that discomfort is relieved, verbalize understanding of individual risk and causative factors, and demonstrate the use of relaxation skills. Now the long-term goal is within the 7 days of performing interventions, the patient will experience relief of pain, verbalization of understanding of condition and treatment, and lastly, patient appears relaxed and sleep properly. Intervention. Interventions are action of a nurse in order to elevate or minimize the pain felt by the patient. So our first intervention is discuss mode of transmission to patient and family about specific infections as appropriate. The rationale here is that provides information to assess client in making decisions related to lifestyle. Now, why do we need to include the family in our interventions? Since our patient is underage, we need to include the family in our interventions because our patients need parental guidance since she is underage. Next is discuss management strategies for persistent signs and symptoms. It is to encourage patient involvement and facilitate patient education. Next intervention is that demonstrate and encourage use of relaxation skills such as deep breathing and visualization. Deep breathing and visualization refocuses attention and control or disease discomfort. Next intervention is demonstrate and encourage use of relaxation skills such as deep breathing and visualization. So the rationale here is deep breathing and visualization refocuses attention and control or decrease discomfort. The visualization will serve as a distraction for the patient to not think of her pain. Next intervention is that encourage client to verbalize concerns, active listen to these concerns and provide support. Now our dependent and collaborative intervention is that administer medication prescribed by physicians as needed. The rationale here is that when we administer medication, it relieves pain and enhances comfort. Now the rationale. Our short-term objectives. Evaluation. The evaluation is the last process of the nursing care plan. With these evaluations, we are going to know if the interventions made help the patient in her problem. So our short-term objectives, goal partially met. The patient was able to verbalize that the pain is controlled but not relieved. Next is goal partially met. Patient verbalize the understanding of individual risks and causative factors but needs more time to fully understand. Since our patient is underage, we don't expect her to fully understand about STI, about sexually transmitted diseases, because they are still young, they are into more different things. And lastly, goal met. Patient is able to demonstrate the use of relaxation skills. Term objectives is that the patient reported pain is relieved or controlled. So this is after the 7 days of interventions. Next is patient verbalizes understanding of the condition, and lastly, patient appeared relaxed and was able to sleep properly. Our next assessment is patient reports urgency to urinate and more frequent urination. So the problem identified in this is burning feeling during urination caused by an infection. As a problem identified here is that burning feeling during urination caused by infection contributes to difficulty in passing void or urinary frequency. So the nursing diagnosis is impaired urinary elimination related to the inflammatory process as evidenced by mild incontinence. So when a person has gonorrhea, it will create an inflammation which triggers the bacterium and gonorrhea. So inflammatory process. When a bacteria enters the mucosal surfaces of our body, it will create an inflammation which causes or triggers inflammatory process When the gonorrhea gain entry to the mucosal surfaces of our body, it will cause an inflammation, and the inflammation. Now, to achieve the planning, we need to perform interventions. Our first independent intervention is determine the client's pattern of elimination. It is to assess degree of interference. Next is encourage adequate fluid intake. Sufficient hydration promotes urinary output and aids in preventing infection. And lastly, provide patient and family with information regarding the treatment plan for options. Parents are a very important support for client under 18 years old because this this age requires more parental consent, more parental guidances. Next is the evaluation. This will prove if our interventions have helped the patient. So our short term is goal partially met. Occasional pain. So this is the after 8 hours of intervention. So goals partially met. Occasional pains are controlled but not relieved. Goals partially met. Patient verbalizes the understanding of individual risks and causative factors but needs more time to fully understand. Our long-term objectives are goal met. Urine output is adequate to individual situation. So within the 7 days of performing the intervention, the patient is able to urinate properly with their adequate amount that is right for her. Next is the patient returns to normal voiding pattern and elimination. And lastly, the patient verbalizes understanding of her conditions. Our third problem is discomfort. The patient reports mild anal itching and awoke from sleep with urgency to urinate. So our nursing diagnosis is impaired comfort related to the disease-related symptoms like itching as evidenced by alteration of the sleep pattern. So patients with gonorrhea may present dysuria, urgency, urinary frequency, and lower pelvic plane. May include inflammation of external vagina causing excoriations. So the planning that we created here is after the 8 hour of intervention, the patient will verbalize that the pain or the discomfort is relieved and controlled. She will be able to verbalize methods that give relief of pain or discomfort, and lastly, demonstrate relief of discomfort. Our long-term objective is that within the 7 days of giving interventions, the patient will verbalize their discomfort is relieved or controlled, demonstrate relief of discomfort, appear relaxed, and rest properly. So the interventions we are going to do is encourage use of relaxation technique that's focused breathing, guided imagery when client is able. So encouraging client with the relaxation techniques may help them focus on something other than the pain and discomfort that they are feeling. Next is encourage verbalization of feelings where possible about discomfort, including pain and aching. So with this intervention, we evaluate the coping abilities and may identify additional areas for concerns. Next is obtain client's assessment of pain to include location, characteristic, onset duration where possible. Encourage client to report changes in pain. So pain because because pain may be considered a form of this since. Next is obtain client assessment of pain to include location, characteristic, onset, duration where possible, and encourage client to report changes in pain. Because pain is considered as a discomfort, and that it should be addressed to. Next is communication techniques such as listening and empathy. With this intervention, the patient will feel understood and accepted, and this will promote comfort for her. Our dependent intervention is that we administer medication as prescribed by physician, refer to primary care provider, and assist with treatment of underlying cause. So lastly, the evaluation. Short-term objectives. Goal partially met. The patient verbalizes the discomfort is controlled but not relieved. Goal met. Verbalizes methods that provide relief and discomfort. Goal not met. Patient wasn't able to demonstrate relief of discomfort, does not appear relaxed, and wasn't able to sleep properly. So our long-term goals is that within the 7 days of intervention, the patient will experience relief of pain and discomfort. Goal met. Next is the patient demonstrated relief of discomfort, appeared relaxed, and was able to sleep properly. Goal met. So, with the help of nursing care plan, we are able to formulate actions and interventions to help client attain her optimal health condition. So when the bacteria gain entry to the mucosal surfaces of our body, it will cause an inflammation, and the inflammations will then cause these symptoms like frequent urination, the pain, and the mild incontinence. So now on the planning, our objective is that after the 8 hour of interventions, the patient will verbalize that the occasional pain is relieved or controlled. Next is able to verbalize the understanding of individual risks and causative factors. Our long-term objective is that within the 7 days of performing the interventions, the patient will display continuous flow of urine with output adequate for individual situation. Next is verbalizes that the voiding pattern is normal. And lastly, verbalization of understanding of condition and treatment.
Application of this case to nursing practice, nursing education, and nursing research. First is nursing practice. This case study will serve as a guide to provide nursing interventions to meet patient needs. The information gathered in this study helps informing certain outcomes related to certain human needs or patient's condition when all the planning has been concluded and completed. Interventions, which are the actions of the student nurses, will then be applied and create a nursing care plan to help client attain or maintain optimal health conditions. Second is nursing education. This case study is significant to nursing education as this assists in promoting health learning and enhances critical thinking in making judgment regarding the delivering of safe patient-centered care, which are important for student nurses. This study is useful because sexually transmitted diseases like gonorrhea infect both male and female, which, if not treated, can present greater risk. Third is nursing research. Nursing research is a research that provides evidence used to support nursing practices. Nursing is an evidence-based area of practice. Nursing research together with this case study is productive and beneficial because it aims to offer a perspective that informs improve patient care regarding sexually transmitted infection like gonorrhea and gives insight to in-depth and complex issues in real-life settings.
Evaluation and recommendations. Prognosis. Upon further assessment, the patient's status is good because of the interventions made. Gonorrhea is a sexually transmitted genital, anorectal, laryngeal infections that may be asymptomatic or symptomatic. It is the second most frequent reported STI or sexually transmitted infection in United States. Gonorrhea rates are highest in adolescents, and gonorrhea is treated with antibiotics. Evaluations and recommendations. Recommendations to promote early recovery and rehabilitations. Information and education resources for individuals with gonorrhea should be culturally appropriate, use a respectful and empathic approach, promote self-growth, and emphasize your support groups. Then, monitor urine culture and sensitivities. Assess the determine the patient pain evaluation, intensity, and elimination pattern, and encourage patient to increase fluid intake into later by day. These are helpful in formulating an individual plans of care to address a patient's specific continence product needs. Then, anxiety symptoms should be routinely screened in all adolescents and women with gonorrhea in order to assess referral for assessment and treatment.